Hi guys, we are covering sexually transmitted diseases today. So an STD and STI we use them the same. So they are an infection caused by a pathogen. Remember, a pathogen is something that causes disease. And they are types of pathogens that infect or get inside of the reproductive system of men and women. Three most common STDs in the United States are trichomoniasis, human papillomavirus or HPV, and chlamydia. So risky behaviors and the epidemic of STDs that we have in our country for effects for short term, you might feel pain, discomfort, and embarrassment, and then long-term effects could be increased risk for certain types of cancers and male or female infertility, meaning you cannot have children. Many STDs that are bacterial or protozoan can be treated with medicine. But if it's a viral one, there are medications that might help with outbreaks, but it is permanent. You will have it for a lifetime. So treatment is not always curing. Treatment means there's medicine to help. Cure means there's medicine to kill the pathogen, okay? Unlike other infectious diseases, this is really important. People do not develop immunity to STDs after being infected. A person can be cured of an infection and then be reinfected again and again with the same STD. So there are lots of risky behaviors that people engage in that increase their risk of passing and getting STDs. So ignoring the risk, so not using protection, having multiple sex partners. So the more partners you have, the more risk you have. And then not seeking treatment. So people can be embarrassed, or maybe they don't even know that they have it. And even once it's in the body, whether you have symptoms or not, you are still passing it to other people through sexual contact. Chlamydia is the most common bacterial STD in the United States. So it is bacterial. So there is a antibiotic that can cure or kill this bacteria. However, it is the most common bacterial STD. There's over 3 million people infected with it each year. And the bacterial STDs, even though they can be cured, they are actually some of the most harmful to the reproductive system of men and women. So it can cause increased risk of pelvic inflammatory disease, which is where that bacteria gets in the reproductive system and it attacks the uterus, and it attacks the fallopian tubes, and it attacks the ovaries, and it causes major scarring. And a lot of women do not know that they're infected because they don't have symptoms. And so when their risk of ectopic pregnancy, remember that pregnancy that implants in the fallopian tube instead of the uterus, that is much increased because of scar tissue. For males, the symptoms would be painful urination and discharge from the penis. Left untreated can cause inflammation of the lining of the urethra. For females, there's a lot that don't have symptoms other than a yellowish vaginal discharge. And again, left untreated can cause pelvic inflammatory disease. Modes of all of these STDs that we'll talk about are oral sex, anal sex, vaginal sex, and birth. So the rate of chlamydia, even though we know how it's caused and how to prevent it, has risen every year. This is a very old textbook, so the numbers just keep going up. So trichomoniasis, this is a protozoan that infects the urinary tract or vagina. Male symptoms is painful urination and clear discharge from the penis. Even if there are no symptoms, if it's present, you are still passing it to your partner. Untreated can cause inflammation of the lining of the urethra. And then for females, itching and burning in the vagina is a symptom. An unpleasant smelling yellowish discharge and painful urination. So untreated can cause vaginitis, which is infection of the vagina. HPV. HPV is human papillomavirus. So obviously this is a virus. It's the most common viral STD in the United States. Some symptoms, if there are any, would be itching or burning, but most don't have any type of symptoms with this. There are actually, we only hear in commercials for the HPV vaccine of 4 strains of HPV virus, like 2 that cause genital warts and a couple that cause cervical cancer, but there are over 100 strains of HPV, okay? So don't think if you get that shot that you are protected from HPV and genital warts or by cancer caused by these different HPV viruses. It is the most, let's see. So a lot of times, it says sometimes, but in over 95% of cases of HPV, the body kills off the virus within 2 years of being infected with it. So most people's immune systems are able to kill it off. Those people that have compromised immune systems, which is a small percentage, maybe like 1% of those people might have complications like genital warts, which look like cauliflower on the genitals, and they actually have to be burned or frozen off of the genitals and can actually keep coming back as well. They do a pap smear to check for precancerous cervical cells or cancerous cells on the cervix for a female. They are not testing for HPV with a pap test. That is done with a blood test, okay? But understand the way that you prevent this is to use condoms, not have multiple partners, do all those things to protect yourself. But the modes of transmission are the same: oral sex, anal sex, vaginal sex, and birth. Gonorrhea, you need to go out. Go back out, I'm almost done, okay? This is a bacterial STD. It's also known as the clap or drip because it is the symptoms. It's like a greenish, thick, pus-like discharge from the penis and the vagina. This one, again, remember, the bacterial infections are the ones that really attack the reproductive system of both men and women, and be left untreated. And if you don't know you have it, how are you going to get treated? Okay, but during that time, it's causing urethritis and attacking the reproductive system to cause infertility. So it can cause infertility in men, and it can lead to pelvic inflammatory disease in women and infertility. Same thing, oral, anal, vaginal, and birth are the transmission modes for gonorrhea. Syphilis is a bacterial infection. It's less common in the US, but people still contract it. So it actually happens in 3 stages. The first stage is where you get painless cankers, which are sores at the site of exposure, and they don't hurt. And then that bacteria is sitting in that canker, and it can spread to other parts of the body. Then the second stage is where sores appear in the mouth and flu-like symptoms develop, and people can develop a non-itchy skin rash on the hands and feet, and it actually can be on the whole body as well. Then the third stage, the symptoms typically disappear, but during that time, the bacteria is attaching itself on internal parts of the body, so on the brain and the heart and the lungs, and it's damaging them during that time, and it can lead to death as well. The early stages can be treated with antibiotics, even past stage 2, but any damage that has occurred to the body is permanent. And this bacteria is also able to get to a fetus in a mom and attacks all the body systems of the baby and can end up killing the baby as well, causing major damage. Genital herpes. This is a virus that causes painful sores in the site of infection, typically the genitals. So you can get genital herpes of the mouth. You can get it in the eyes if you get semen or vaginal secretions that are infected in those areas as well. Modes of transmission: oral sex, anal sex, vaginal sex, kissing. So the herpes simplex virus can be found in your saliva, so it can be transmitted. So if you have genital herpes of the mouth, you can transmit that to somebody else as well. A woman with genital herpes can pass the infection to her infant during childbirth. So if a mom has a genital herpes outbreak during labor, they will do a C-section to keep the baby from coming in contact with those blisters. And then a person can pass HPV, or sorry, it says genital herpes. I don't know why it says HPV. Genital herpes to a sexual partner, whether blisters are present or not. There's zero cure for genital herpes, but there are medications to shorten outbreaks of the painful blisters. Just remember the anatomy. Like for women, if a woman has genital herpes outbreak, a lot of times it's in the vagina. Like you cannot see that she has blisters there. So you can't just trust that you can see what somebody has as far as the disease. You need to be smart. You need to look out for yourself. People need to be tested, and you shouldn't have multiple sex partners either to reduce your risk. Hepatitis, we've talked about this in other units. This is the hepatitis B and C are caused by blood, infected blood, like through needles or body secretions, so like semen, vaginal secretions. You don't generally have symptoms until it's really attacked your liver. There is a vaccine for hepatitis B. There is nothing for hepatitis C. Let's see. So some of the symptoms, once really it caused issues with the liver, would be fatigue, which is tiredness, abdominal pain, nausea, and jaundice, meaning like the whites of the eyes turn yellow, your skin looks yellowish, orangish. And that would be a sign that something's going on with your liver, and they would do a blood test to check. There is no cure for these.